I'm Dr. Kevin Kaplan from the Jacksonville Orthopedic Institute and head team physician for the Jacksonville Jaguars. I'm here at the JCA, Jewish Community Alliance, giving a talk about shoulder injuries, shoulder symptoms, and how we treat them. The goal of the talk is to define the basic anatomy of the shoulder, bring it down to a level that patients can understand, and go over the different signs and symptoms of shoulder pain, the different diagnoses that I see in my office, and how I treat them. So we've come a long way. We used to do these things with big open incisions. Now we do these arthroscopic surgeries with tiny incisions. And we really got to look at the tear pattern. And I won't get into the specifics of this, but not every tear is the same. That's the one thing I really enjoy about this actual surgical procedure when it's indicated, is that it's really trying to figure out how it's torn, where it's torn, and how to get the anatomy exactly the way that you were when you did not have a tear. This is the surgical technique that I use these days, and it's a technique that basically compresses. Again, here, this is such a big area of rotator cuff. So you're trying to get this whole tendon to compress down to the bone. And this is the technique that I learned out at Curl and Job when I was a fellow out there. This is the newer procedure for patients that have a rotator cuff tear like this. So this is the ball, this is the socket, this is the rotator cuff. This should be way over here. So it's retracted about 5 centimeters. When you go into that shoulder joint, you can imagine if I was to try to pull on this, it would be almost impossible to get that all the way over because there's no pliability, there's a lot of tendon shortening, and it would be almost impossible. And if we did try to get that tendon repaired, it would be under such high tension that as soon as a patient brought their arm down, it would probably separate and pull loose. Surgery is a big deal, no matter how big or small the surgery may be, and it's always important to have as many eyes on it as you feel comfortable. And when you go into surgery, you want to feel comfortable that the surgeon has given you the right opinion, has diagnosed the problem correctly, and is going to make you better than when you walked into the office. So you have symptoms of shoulder pain and you need more information, come visit us online, joi.net. You can see me at my website, www.kevinkaplanmd.com, to learn more about the shoulder. If you have symptoms that don't go away, pain at night, pain when you lift your arm over your head, clicking, popping, come and see us at JOI. We'll be happy to help.